friends. We are really blessed and privileged to have Professor Krishnamurthy, who is very well versed with the subject. Not only that, she has got a unique special quality of dwelling the subject elaborately. He will take you to the root of the subject in such a simplified manner. Whatever has been taught will be in your memories forever. It will be green in your memories forever. With this, I extend a very hearty welcome to my beloved associate, Shri Lakshmana Krishnamurthy, to kindly take charge. Welcome, sir. Namaste.
These sessions are planned for semester 5, but there is no reason to say that it is only for semester 5. Okay, like anyone from probably from anyone from second semester onwards. Okay, second semester to 10th semester, they can join these classes, and it would help them. Okay. And I request all of you to make notes while you are hearing this. Okay, because while hearing everything sounds nice, but later on, if you want to find that information, or you will find it difficult. Sem 1 is basics of TCM. Sem 2, you learn pattern diagnosis based on standard patterns. TCM patterns. So there are about 100 patterns. Okay. In semester 3, we learn Dr. Wohl's electroacupuncture. Sem 4, we learn extraordinary. Now, what do we learn in semester 5? Whatever you have learned in these semesters, clubbed. So we start learning in treating individual organs. Okay. So in semester 5, we learn treating heart, lungs, kidney, and digestive system. Okay. Specifically, which involves pattern-based diagnosis, which will involve electroacupuncture and also extraordinary vessels. Okay. And in semester 6, once again, we will learn probably female-related diseases and very special kind of cases. Those things we will learn, and these things in detail we learn. Now, what is so special? Okay, if you read the book, like say today we will learn about heart. Okay, treatise 11. Treatise 11, we will try to learn. For you to become a good therapist, if you want to handle these things, what is a prerequisite? The prerequisite is you should be super solid in semester 2. That is treatise 7. Okay. That is the bread and butter of the TCM people. you should be really good in understanding the patterns. Okay, if you are not strong, then you will not be able to do a good job going forward. Okay, so one of the aim of this course is not just to make you understand this, but to make your semester 2 treatise 7 strong. Okay, so these are the aims. So in treatise 2, okay, that is in, say, like all the patterns are discussed in treatise 2, treatise 7 itself, that is in second semester. What is there to learn in future semesters? Semester 2 and semester 5. What is the diseases that a heart can have as per semester 2? What diseases can heart have? Heart,
Chi,
heart,
Chi excess deficiency. Then we have
heart chi deficiency.
stagnation. So are associated with it.
Okay. The heart chi deficiency is a disease. Then heart yang deficiency is a disease that heart can get as per TCM. Then heart yang collapse is a disease that heart can get. Heart yin deficiency is a disease that heart can get. What else? Then heart blood deficiency is a disease that heart can get. Okay, so these are the deficient type of diseases that heart can get. And what are the other types? It can get heart fire blazing. These are the excess type of condition. Okay, heart fire blazing, where heart fire has become more. Okay, and phlegm fire harassing the heart. That is one type of excess. Phlegm misting the heart or mind. Is another. And heart blood stasis. One more disease. Okay, these are the basic patterns. This is the excess type of disease. Okay, so 5 plus 4, 9 diseases is what the TCM says that you can get in the heart. Okay, that is what we have learned in semester. We have learned in semester 2. Right. Now, in semester 7, sorry, semester 5, what is that we are going to learn? What are the diseases as per, what are the diseases the heart can get as per treatise That is in 5th semester, that is treatise 11. Okay. So we can get, I'll start writing from something simple. Okay. High BP is a disease related to heart. Then low BP. Okay. We can say in terms of, but this is in terms, these are in terms of pressure. And the other thing is in terms of pulse, how many pulse is the heart is beating. If it is more, we call this tachycardia. And if it is less, we call it as bradycardia. It is in terms of pulse rate. Okay. We have something called heart attack. Or myocardial infarction. Okay. Okay. High cholesterol. High cholesterol, heart block.
Inflammation.
Okay. We have rheumatic heart disease. Hole in heart. Hole in heart. Okay. Portal hypertension, cardiac arrhythmia. Okay. Okay, the rhythm is not proper. Okay. Arrhythmia. Pulmonary heart diseases. There is angina pectoris, that is pain in chest. Endocarditis, endo and pericarditis, pacemaker syndrome, shock, and problem with valves. Okay. What do you think? Laughter, crying, children. Okay. So, etc., etc., etc. Now, TCM people say these are the problems that you can get. But Western people say these are the problems that you can get. Is there a match anywhere? Anywhere, like, do you see anything correlating between this list and this list? Do you see anything correlating?
Cause and effect.
Hmm?
Cause and effect.
Who is that?
Sunita, sir.
Sunitanjali. Yes, very good. Excellent. So when I treat, these are all effects. And what is causing that effect? Are you able to understand? Now, hole in heart, or what can I say? Like say high cholesterol, or there is some block in heart. Imagine. So the effect is there is blockage in heart. So what is the Western medical science do to treat this? So
Angio.
Blockage is to be removed.
Angio.
So
Angioblast,
Angioblast.
solution
or maybe
prescribed.
they'll go for bypass surgery also.
Yes.
Okay. Solution that they will do is they will put a stunt, okay, to open up that area, or angioblast, or they will give blood thinner. Okay. These are the type of solutions which are given. Okay. So it is working on the effect. But what is the cause? Why did the block get created?
Wrong
Because
five
of phlegm.
in the blood.
Hmm?
Imbalance
Because
of
of
5 elements in
phlegm.
the blood that carried the blockage.
Okay. So there could be, the reason is there could be excess cholesterol or fat in the system, which is traveling in the blood, and for some reason it is getting accumulated in the area. So if I put a stunt, I will only open up that area, and the problem is what? The excess fat or cholesterol, which is getting still traveling in the body. Now, what is the solution? So if there is excess fat, the blood will be thicker. So they will give one blood thinning medication. Okay. So these two things, is it addressing the cause?
No, sir.
What is the
Not
cause?
at-
What is the cause? What is the cause?
Food habit.
Hmm?
Wrong food habit.
The earth element is more here, because of which the cholesterol or fats are getting accumulated, means they are getting generated,
Hmm?
and that is infused into the blood, and that is traveling to the heart.
Hmm.
Since the heart vessels may be little sensitive,
Hmm.
or maybe more attracted towards this cholesterol, and they are sticking those in their vessels.
Hmm.
One cause may be this.
This is as per a layman. If Mayank Todi had not been studying acupressure, and if he had told all of this, I would have accepted. But now Mayank Todi is not a
Increase
layman.
heart fire.
Huh?
We should increase heart fire and circulation.
So that it can melt.
Huh.
What
Spleen
else?
key deficiency.
Yeah.
Spleen key
Let's
deficiency.
say it is stomach key deficiency, sir.
Who manages the earth element, the fat?
Yes.
Spleen and stomach, right? So your digestive process is not strong enough to metabolize the fat. That is why fat is getting circulated in the blood, and here and there it is going and creating blocks. Now, what is the solution that we have to do? We have to Cause, what is the
Make
cause?
the spleen behave in the homeostatic way.
Poor digestive system. Is it not? So now what do I treat? I treat for time being. So if there is something getting built up in the heart, okay, blockage is getting built up. So for time being, I will work on the effect. Okay. Then I will come to the cause. So I am working on the effect for time being always. So I am working on the effect, and then what I will do after taking care of the effect, I will come to the cause. Then what I will do, I will come to the further root cause. Why is the digestive system poor? Why is the digestive system poor? Probably the essence is less. So what will I do? I will work on the essence. Kidney essence. Right? You see the flow? I am not getting stuck in the effect. I am traversing towards the cause and moving towards the root cause. Okay. Making sense?
Yes, sir.
Yeah.
Sir.
There can be other ways of changing. Let's say bradycardia. That is, pulse rate is less, low pulse rate. So what should be the pulse rate? It should beat on an average 72 times per minute. But if it is, let's say, I don't know the exact value. Say if it is beating at, say, 45 beats per minute, then it is called low pulse rate.
Bradycardia.
So now what will be the solution?
Essence is less, then we have to go to the root cause of lungs chi deficiency.
No. Now, this is the second scenario I am taking. Say if there is bradycardia, what will the Western medicine people do? Solution. What is the solution which is offered?
Medication for increasing the heart rate will be.
No, pacemaker. They will put pacemaker.
So they may add a pacemaker.
Yes, sir.
What is the work of pacemaker? To increase the pulse rate. Okay, so it should beat in the right. So they will put one device onto the near the heart. So it will make the heart beat at the right pace.
Regulating.
It will regulate the pulse rate. That is a solution offered by the Western medicine. Now, what will you do? So bradycardia is a
Low pulse rate.
Cause or effect? Bradycardia.
Effect.
Bradycardia is an effect. It's
Effect.
Okay, problem, symptoms that we are seeing. Now I have to go to the cause. What is the cause? What could be the cause? The cause could be
Heart pumping less.
heart chi is deficient. Heart's own energy may be less. That is why it is beating less. Okay. Or what else can be another problem? Who controls heart? Who controls heart? Who controls heart?
Kidney.
So the kidney chi may be deficient. That is why the heart is not able to function properly.
Okay.
Okay. What else?
Mm. The true chi coming from the lungs to the kidney is not proper, maybe.
Could be. So the energy of the lungs is not sufficient. Lungs chi may be deficient.
Liver may be
Hmm?
deficient. Liver may be deficient.
The mother of the heart, which is liver.
Yeah.
Liver's blood may be deficient. Liver blood may be deficient. So if liver blood is deficient, why the liver blood is deficient?
Blood
Heart heat,
making illness.
liver heat,
Maybe
liver heat.
because there is excess heat in the liver and it is ever, no? When blood is subjected to excess heat, what happens? The blood reduces.
Production of
Like if you have sambar and if you heat it too much, what happens to the sambar? It will increase in quantity or decrease in quantity?
Decrease.
It will
The
become,
water will evaporate.
decrease and
Yes,
it will
sir.
become thick. No, the same thing happens in the body. So if there is lot of heat in the liver, what happens to the blood which is stored in the liver? It goes down. So, and it will cause what? Liver blood deficiency. This is one
Deficiency.
cause. Right. That is, the liver blood deficiency may be because of liver heat, or the actual production of blood may be less.
Spleen deficiency.
Production of blood may be less. Why is it less?
Anemic.
Probably spleen is deficient. That is why production of blood is not happening. Okay. Or there may be some kind of, say, blood in the heart may be less. Heart blood deficiency. Why is blood deficient in heart or liver? There can be some kind of, say, leakage. One is production may be low, or there can be some kind of leakage of blood or loss of blood. I should say loss of blood.
Sir, what is that case? That means there is internal bleeding.
Loss of blood. I will come to it. Loss of blood. Loss of blood can be external, internal,
Internal
and internal.
and as well as external also, because if we have some wounds, accidents.
There is some injury.
Hmm.
If there is some injury because of which there is a lot of blood got lost, so the blood in the system will be less. Okay. Or internally there is some kind of bleeding. Say there is piles, bleeding piles.
Okay.
Okay. Whenever, every time they pass stool, blood also goes out. Okay. Bleeding piles. And then there can be, in women, there can be excess menstruation. Excess menstruation. Okay. And there can be some kind of hemorrhages inside the body. So where the blood is getting lost, or like they may be vomiting blood for some reason. Any other kind of reason. Now, the root cause is somewhere here. Say somebody is having bleeding piles, and that is making the blood less in heart and say liver. And because of low blood, their pulse rate is less.
Low.
So if I just put a pacemaker, will it help
No.
without fixing this? Will it work? No.
No.
It
So
is only temporary.
temporarily it will work.
Temporary.
So now I will have to find the root cause and root cause. And this is the power of, and how do you fix all of these things? All of these things that I am discussing, from which knowledge will you fix it? Which semester's knowledge will you fix it? Semester 5?
Elementary.
Fifth sem knowledge you will fix it?
Semester 2.
Semester 2.
All of this, liver blood.
Semester 1.
No, semester 2. All
Semester
you will fix using semester
2.
which you have already learned and you are master of. Okay, right? Yes? No? Nobody is shaking their head. Huh?
Learned and forgotten because not practicing.
Okay. So all the solution that you will end up giving is in semester 2.
Yes.
But what is semester 5 teaching you? What is semester 5 teaching you?
Teaching us the root cause and how to treat them.
It is
Maybe.
Linking
It is teaching us the effects of
linking the effect and
various
the cause.
diseases. Various diseases. Yeah.
it is teaching Western way of understanding the problem. Western way of understanding the problem and then translating the Western way of understanding the problem and treating via
Thank you.
our patterns. Clear? What is semester 5 teaching you? What is semester 5 teaching you?
Western way of
Understanding the problem
the
and
problem.
treating according to TCM.
This is what semester 5 is teaching you.
Very good. Nice.
And this thing, see, can you directly say high BP? What can cause high BP? This can cause high BP. Heart fire blazing can cause high BP. It is excess condition, right? And say heart yin deficiency can also cause high BP. This is also yin deficiency is empty heat, right?
Yes. Yes.
Heart yin deficiency is empty heat.
Yes.
And heart fire blazing is full heat. So a full heat can cause high BP, an empty heat can cause high BP. And heart indeficiency may be linked due to a kidney indeficiency. You start seeing the web of causes. So going forward, you should never ask, never ask, give me points for high BP. What is the protocol for high BP? Can you give points for high BP?
No, sir.
Is this causing high BP? Is this causing high BP? Kidney indeficiency is causing high BP. What is causing high BP? Is a blockage causing high BP? How do you know? So these questions, these sort of questions, okay, What is the protocol for high BP? What is the protocol for this? What is the protocol for that? Is all very childish, no? Childish way of thinking and learning. So like if somebody is in first semester, second semester, and they ask these questions, yes, they are, we know that, okay, they are still learning, and they can be, some generic kind of points can be given. But once you are coming to fifth semester and still asking the same childish question, then it is not acceptable. Is it acceptable? Like if any of
We
you
have
ask
to
me,
see the symptoms and go to the root cause. Then only we can give the protocols.
if you are fifth sem student and if you ask me, sir, protocol for high BP, what should I do? Huh?
Revert him to semester 2 then.
Huh? Okay, so you should give at least 10 symptoms and then ask, so what is the solution for these 10 symptoms? Then probably I can think, okay, you are progressing, right? Making sense?
Yes, sir.
If you want to, raise hands, those who want to become very good therapist, achieve something in this field. How many of you? Click on raise hand button. 1, 2, 3, 4, 5. Only 5.
No, sir.
How many?
Where is
Others?
this chat?
Others?
Reaction.
Click on raise hand button. How many want to become good, high quality therapists? I can only see 4 hands raised. 5. Somebody has raised 2 hands. Okay. See, you can literally do magic. Okay, you can, when I say magic, literally, and you will be thrilled to the core of your being. The way the results come. I had told in one of the earlier class regarding the squint. Okay. The squint I corrected, and recently I corrected one more squint. I think 12, 13-year-old child. Okay. The case is that one eye, that is the right, the left eye is power is -2, and the right eye power is -20. -2, -20. So basically, when the child closes the left eye and tries to see only through the right eye, almost nothing is visible. Like it is, and along with that high power, that is -20, the eye is squint in the right eye. Okay, so I was trying different things. It was not suiting. No, slowly I was treating, and when I was trying, I was thinking I should treat this as a paralysis. Okay, so in that concept, I gave this phlegm misting the mind. Okay, phlegm misting the heart or mind, which we give in the paralysis of the right side paralysis. Okay, so, and I gave this, and the eyes instantly, the squint instantly got corrected. Tuck, it came. And I remove the magnet, it goes back. I put the magnet, it comes.
How is that possible, sir? Can you explain?
Yeah, I will have to deviate a lot into the subject, from the subject. Okay, I will discuss when I am discussing this phlegm misting the heart. So it is so superb. Like, what is required? Requirement is that you should spot the pattern properly. If you can do that, you will see fantastic mind-blowing results. Okay, so if you have to become a very good therapist, high quality therapist, then what is expected is you should be, first of all, very super good in pattern based diagnosis. Like there are some about, let's say, 100 patterns in semester 2, let's say standard patterns. Okay, why do we call standard pattern standard patterns? I will explain this. This 100 pattern, you should be super good. Okay, then what will happen? You will have to, so this is the first step, that you will have to be super good in that standard 100 patterns. And second is that you should be good in converting the Western way of understanding problem into our Eastern way of understanding the problem. That is Western to TCM. Okay. Most of the problem can be solved with, like, a large chunk of it can be solved through these 100 patterns. But in some cases, what we have to do, we will have to add some extra points, plus minus, we may have to add or delete some points based on the specificity of the problem. Okay. So for all of these things, there are two very important things: understand the standard patterns thoroughly and translate the Western way of defining the problem into our TCM way of defining the problem. If you are good in these two things, then you can become a very good TCM based therapist. Make sense? Make sense? I don't get any.
Loud and clear, sir.
Yes, sir. Yes, sir.
Okay. Like it's like you are getting what? No, here. Like, what is
It's
happening?
getting very interesting, sir, now.
Eye opener.
Nobody is
Eye
getting
opener.
nobody is getting afraid.
We are getting inquisitive to explore more now.
Yeah. So, like, once you get this grip, no, you will feel like you will feel so good about yourself. Like you will feel like you have supernatural abilities. Almost like that you will feel. Because you can solve problems like this. Right? So, like, please put efforts, and if you can do these, the science will grow, flourish, right? Okay, so it is based on how well you perform. It is, who gives you the mark? The examiner will give you the mark.
No, sir. We have to
Our
set
own-
our standards, sir.
Patient,
It
sir.
is,
When the patient comes
yeah.
and he cured.
Every patient is your examiner, and he will give the
The
mark.
result of our treatment will give us our
Give
marks.
us marks.
Yes. And if you and if that examiner is not happy, then there is no point of having any of the marks in this paper, right? So, and it gives you enormous amount of joy, because every complex problem you solve, so much happiness you will get, right? Okay. And what is this? So I'll take class up to 9. Is it okay?
Yes,
Yes, sir.
certainly.
For me.
Yes,
Yes, sir. Yes, sir. Fine.
Fine. Okay. So what is this standard 100 patterns? Oh, who wants to say what is this 100 patterns, standard 100 patterns? Yes. Tell me, who wants to say?
One of the ways can be diagnosis, through different symptoms. Symptoms, emotions.
What does it mean? What does it mean?
Sir, what type of, whether it is G deficiency or whether it is blood deficiency, or to identify.
Okay. What else?
Sir, stagnation is
No, I'm not asking for list the TCM standard patterns. No. I am asking what does it mean?
Based on certain symptoms, we are identifying one pattern. For example, cold outside. Anything we are affected with acute coldness, we generally treat with external wind cold. So the minimum observation through which we can connect to a pattern.
What is that pattern?
The 8 guiding principles.
Combination of
which are
points.
that standard TCM pattern, the 8 guiding principles. No.
What is? You all have learned this, no? Second semester.
Sir, access deficiency yin yang.
4 way of diagnosis, 8 guiding principles, yin yang,
No.
said deficiency.
No. What is the meaning of standard pattern?
Control and
Standard patterns means the set of protocols which are given for a particular pattern of disease. Does it mean that, sir? Like we are using a particular, the particular protocol for a particular pattern. So does that means it is a standard way of treating?
Elaborate a little bit more.
Patterns raised out of that case studies.
Whose case study?
Standard means, sir, the written protocol which they are following for a particular type of for a particular type of disease, whether it is kidney essence. So whatever protocol is there for that is the standard pattern.
I'm not getting the answer that I am looking for. Okay.
Okay, so let us, think more about it.
Okay.
So you can give us some hints, sir, so that we
Standard pattern means, say, there are organs, right? We have different organs. Okay, heart, lungs.
Interrelationship, sir,
Okay.
between the internal organs.
Okay. No, I'm trying to explain. Okay, we have different organs. And these organs are like, you can understand it to be different human beings. Okay. For time being, understand them to be like human beings. Okay. So each human being has, whenever there is a situation which comes, they have a a pattern in which they react. Okay. So as soon as you wake up, what can you do? What would you do? You will have a pattern. So you would wake up, okay, do namaste to God's photo, and then go to washroom, and then come back and drink a glass of water. Okay, so this is one pattern. And somebody, as soon as they wake up, okay, they just sit back and relax for 5 minutes, and then they step out of the bed. Okay, this is a second pattern. Okay, and third pattern, as soon as they get up, they will yawn, big yawn and big stretch. Okay, fourth pattern. And fifth pattern, as soon as they wake up, they take a mobile phone and do this. Check, 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 they will check. So these are some standard way in which a person reacts as soon as he wakes up. Anything else happens? Anything else happens? More or less, this is what most of them do, right? Yes, no? So
Yes, sir, yes.
there is a standard pattern in which majority of the human beings behave when they wake up. So let's say there are some 10 standard patterns while waking up. Okay. And second scenario, when somebody scolds you, left, right, and center. Okay. Say you are there in front of 10 people, somebody scolds you, insults you badly. So what is your response? Either you will cry or you will be angry or you will argue or say physically abuse that person who is scolding you. Do some sarcastic expressions on the face. Or just walk out. No, these are the standard responses that one human being can give when they are like insulted, right? Or anything else. More or less, these are the patterns in which they respond while insulting, for insulting. So similarly, for different situations, more or less, there are different patterns in which a human being responds. These standard responses, if you club for all situation, it becomes standard pattern for human beings' responses. Similarly, each of these organs behave in a certain way for a certain situation. Okay. There are not infinite. Do you have infinite variations when you wake up? Or very finite way of variations?
Finite.
Finite.
Finite. How much? 100, 300, 500, 1000 or 10, 20 or
10,
5?
20.
5, 10, 20. That's all, no? Or is there any large?
It's
No,
limited, maybe 10, 20, we can say.
not more than that, no? Like while waking up, these are the things that most of them do. Okay. Similarly, heart, what will do when fire increases, it will behave in one way. Okay, if no earth increases in the heart, it will behave in another way. When fire and heart both, okay, I was telling that heart, okay, if fire increases, it will behave in one way. If earth increases in, no, it will behave one way. So if both fire and earth increases, it will behave in another way. Okay, so if water reduces, it will behave in one way. If fire reduces, it will behave in one way. If both fire and water reduces, it will behave in one way. So these are the standard protocols. Okay, and they have the ancient masters. Okay, they have identified about 100 standard patterns in which the organs behave in different circumstances. Okay, heart will have some 10, liver will have some 10, 15, and stomach will have 4, 5, spleen will have some 4, 5. So this is how they have figured out these are the patterns in which the organs behave. And they have given the points for these standard behavior. Points also have been given. Okay, I will write it in a different way. So they have identified the 100 standard pattern and they have identified the symptoms. Symptoms for these 100 standard patterns. And they have also found out the points for these 100 standard pattern. And these points, 100 set of points, is what we call it as standard protocols. Standard TCM protocols. That is heart chi deficiency, liver key stagnation, etc., whatever we have. These are the standard patterns which who has figured it out? Ancient masters. They have told, okay, this is what more or less will be there. And in one book I have studied, I read that some ancient master is telling that there is no disease which is too complex to be, there is no disease which is too complex, which cannot be treated which can not be treated by these standard TCM patterns. The master says there is no disease which is too complex, which cannot be treated with TCM patterns. So, like what he is trying to say is every problem that the human body gets can be treated with these standard patterns. That is what the master says. So, if all diseases can be fixed through this standard patterns, what is that we have to do? So they have given the symptoms and they have given the points. What is that I have to do? Do I have to invent points, figure out points, create points? Nothing. I don't have to do. Only thing is I have to see the symptoms and see what is the pattern. And then apply these standard points. That's it. As simple as that. I have to understand the symptoms, see which pattern has these symptoms, and for that symptoms, there is a set of points which I just have to apply. This much if I can do, like I am already a like 60-70% high quality therapist. If I can do only this much, I have already become a good therapist. I can say 60 to 70%. And remaining, so I will add some points, some EOV points, some EAV points, or remove some points and use local points. Those little refining, if I do, I will reach from 60 to 80. Right? And remaining 20 is your hard work, grace of gurus, grace of God, and your persistent work, your curiosity to go deeper, and all of those things will give you another 20%. So is it difficult to become a good therapist? You don't have to invent the wheel. You don't have to invent the wheel. The masters have already done and given. You just have to see properly and apply it. And only with this, you can create so much of magic. Trust me, you can create what?
Magic, sir.
Magic.
Literally, when I say magic, literally it means, you will start seeing, like I think I have told this example also. One patient comes with dark circles. Okay. And there is one protocol called excess chi in pericardium. Okay. So I apply that protocol, and right in front of my eyes, the dark circle is receding. I am seeing the dark circle is slowly receding back. In say half an hour or so, like 30-40% of the dark circle reduced right in front of my eyes, and I was just sitting and seeing. It is so phenomenal. It is so phenomenal. Do you also want to do such kind of magics?
Certainly, sir.
And it is not difficult. It is very easy. So only thing is it some dedication and curiosity in your mind. Okay. So we will, in the future classes, we will go one by one, like each of these standard patterns, and we will try to understand them. I want to make your fundamentals strong as possible. Okay, that is the goal. And then we will also see this, like in syllabus, this the entire treatise 11, the time allocated is only like 3-4 hours, and it is not sufficient, right? So I'm not keeping the time as a constraint, like to my heart's content, how much ever I feel I want to teach. Okay, so it is not necessary that there is always one pattern. Generally, it is never one pattern which is existing in the body. There will be multiple patterns going on, okay, of different organs. And that is what you will have to understand, how you can connect. One pattern is causing another pattern, and this pattern is causing another pattern. How do I know what is the strategy that I should use in approaching that problem? Should I handle this patterns first, or this and this pattern, or this and this pattern? First, we should be able to identify, is there 3 patterns going on in the body, 10 patterns going on in the body? I have to make a list of it. And from that list, I will have to figure out what are the patterns which are very similar to each other and which I can fix. Say if there is fire in heart and fire in stomach, I can treat both of them together. If there is fire in liver and fire in heart, I can treat both of them together. Is it not? So if there is yin deficiency in kidney and yin deficiency in stomach, I can treat kidney and stomach together. So these, when to treat first, what to treat second, what are the combinations we have to use, all of these things is what makes a therapist an excellent therapist. How good is your problem solving? How do you approach the problem? So we will try to understand these things in this course. So I hope it was useful and you enjoyed the course, today's class.
Thank you, sir.
Highly
Sir,
useful.
for
Thank you so
example-
much.
Did you all?
Friends, please stay for a moment. See, one thing I would like to tell, this kind of analysis and interpretation, really I'm not, without bias, I'm telling you will not get it anywhere. Whatever the praise or award we give for Krishnamurthy, it is insufficient. That kind of, classical teaching is happening. This is a, revolutionary kind of teaching. Every time I attend this session, I really enjoy and get so many new insights. though, you know, I'm senior in age and my experience, I mean, senior student in aspects, but still, when I come to attend his classes, I really learn a lot. So, you know, please keep it up, Krishnamurthy sir. Thank you very much. By your gesture, I'm sure this divine science will reach to the maximum people. We are carrying forward the motto of our samsthan to reach one, treat one, and teach one with the, you know, what we say, the pathway of Kemkaji is to operate from a giving domain unconditionally. He is to inspire others. Like that, now, you know, I can see Kemkaji through Krishnamurthy. I'm not exaggerating, you know, this kind of inspiration, I got it from Kemka. Now I'm getting inspiration from Krishnamurthy also. I really appreciate him.
Thank you, everyone. Have a good night.
Thank you very much, sir.